You're probably hearing a lot of conversation in the news now about contact tracing. And you're probably thinking, what in the hell is that? Let me tell you a little bit about contact tracing and about 5 things that I want you to know about how you can assist in the contact tracing process. For those of you who don't know what contact tracing is, let me read to you directly from the CDC's website. In contact tracing, public health staff work with a patient to help them recall everyone with whom they have had close contact with during the time frame while they may have been infectious. It's important for a variety of reasons. 1, the disease is highly contagious. 2, it's possible that you could have the virus and not have any symptoms. And 3, they want to be able to track where the virus is actually gone from person to person. 1, so that they can determine if there are other patients out there, and 2, so they can isolate you so that you don't actually pass it on to someone else. Here are 5 things I want you to keep in the back of your mind that's really important with regards to this so that you can play your part to assist in the contact tracing guidelines. Keep a journal of the places you've gone. Be mindful of who you've engaged and who you've talked with. At least keep a track of it, so this way, as time progresses, if something happens and maybe you show signs or something, you can go back and have something you can refer to so you can let the public health professionals know exactly where you've been and who you've dealt with. It's not about the names, it's about the contacts. What you want to do is you want to be able to identify with some degree of specificity in terms of who you've been dealing with. So if you went to the grocery store, and pay attention to around the time you went to the grocery store, indicate if you had the opportunity to interact with a checkout person. Did you do self-checkout? Did you ask anybody for help? Did you go to the produce line? If you went to a restaurant to get takeout, did you have to go in and manually take it from somebody, or did somebody bring something to your car? Pay attention to those things, because this gives them the ability to be able to drill down. You just want to be able to tell them with degree of specificity who you've been interacting with in terms of the circumstances that you are interacting with someone. Number 3, 6 feet. Who have you been interacting with or have been within 6 feet? But if you're checking out at the checkout line, you're probably going to see that. Okay? If you're checking out at the checkout line, if you're going to get food from takeout, if you're going to your pharmacist, pay attention to what they're wearing. So if they're wearing a protective mask or rubber gloves, so that you know this ahead of time. Get a thermometer. This is going to sound crazy. You're like, that's not part of the contact tracing. Well, to a degree it is, because if they have to isolate you, they want you to be able to, if they determine that you've been exposed, whether it be through testing and so forth, they want you to be able to monitor whether you start displaying symptoms. And one of the symptoms that we know so far is a fever. So if you don't have a thermometer, see if you can get your hands on one, so that if you have to quarantine or self-isolate because you've been exposed, you can start monitoring this closely. Notify the health department or your doctor. Don't freak out and try to figure out who you need to talk to. And contact your provider and ask them if they can tell you who you need to reach out to let them know if you believe you have symptoms. Or if you don't have a doctor, go to the health department. They are in connections with the various local and state and federal public health officials, and they can do what's necessary to put you in contact with the people so that they can keep track of you. We have to be able to track where this thing is going. This is a natural part of the process in terms of being able to trace it. We want to be able to find and follow this thing, so this way we can be on